Hey everyone, today we're diving into the thrilling world of being stuck. And no, sadly, Google Maps can't help you with this one. We're all talking about something that everyone experiences, but no one likes to talk about constipation. Yup, today's video is going to be a little full of it. Pun totally intended, doc decoded, where we take the weird, the awkward, and the downright gross parts of health and make them easy to talk about. That's why the today's hot topic, constipation. Quick question before we start. When's the last time you actually celebrated a good poop? Be honest. We've all had that one moment where you feel like you deserve a medal. All right. What exactly counts as constipation? It's not just missing a day here or there. Medically, constipation refers to persistent, difficult, infrequent, or seemingly incomplete defecation. It's defined as having less than 3 bowel movements a week, plus stools that are hard, dry, painful, or feel incomplete. Kind of like ordering a pizza and only getting one slice. Deeply unsatisfying. The world's longest recorded interval without pooping is 45 days. Please don't try to beat that record. Seriously. Many constipated patients have a normal frequency of defecation but complain of excessive straining, hard stool, lower abdominal fullness, sense of incomplete evacuation. The individual patient's symptom should be analyzed to ascertain what is meant by constipation or by difficulty with defecation. Some weird but true facts. Doctors usually finds among people. A person whose parents attached a great importance to daily defecation will become greatly concerned when he or she misses a daily bowel movement. Some children withhold to gain attention or because of fear of pain from anal irritation. Some adults habitually ignore or delay the call to have a bowel movement. Why does constipation happen? So why do our guts suddenly decide to take an unexpected vacation? A lot of reasons. Low fiber intake. No fiber, no fuel for smooth movement. Dehydration, dry intestines, stuck poop, grumpy you. No movement. Your gut loves it when you move too. Ignoring nature's call. Postponing it can reprogram your colon, and not in a good way. Medications. Some pills treat one thing and mess up another. Medical conditions. Cancer, tumor, hypothyroidism, diabetes, IBS, the usual suspects. Psychological factors like depression or anxiety. Some rare conditions include high anal sphincter tone, failure of perineal descent, or paradoxical contraction, and tenderness of pelvic muscle during straining to stimulate stool evacuation. These only doctors can diagnose, not by common people. When's the last time you drank water without being reminded by your smartwatch? Hey, no judgment. Me too. Chronic or long-standing frequent constipation generally results from inadequate fiber or fluid intake or from disordered colony transit or anorectal functions resulting from neurogastroenterological disturbance. Isn't it too difficult? Neuro, gastro, entero. Let's not complicate it. Just simply consider that your intestine is unable to push your food towards your anus because of certain nerve-related disturbances. Constipation of recent onset, maybe symptoms of significant disease such as tumor, anorectal irritation, stricture or partial blockage, etc. Sometimes it also happens that constipation of any cause may be exacerbated by hospitalization or chronic illness that lead to physical or mental impairment and resulting in activity or physical mobility. Signs you're dealing with constipation. Wondering if you're officially in constipation club? Here's what to watch for. Hard, dry, or pellet-like stools. Not exactly Instagram-worthy, right? Straining like you're lifting weights at the gym, but it's just you and the toilet. Feeling like you're never completely done. Bloating, gassiness, or that heavy ugh feeling. Let's have a mini quiz. True or false? Holding your breath while pooping helps. False. Please don't turn it into a full workout. How to get things moving again? Naturally. Good news. You don't have to suffer silently. There are simple ways to get the traffic flowing again. Hold up fingers playfully. Fiber up fruits, veggies, oats, beans. Your colon loves them. Aim for 25 to 30 grams of fiber a day. And no, sadly, pizza crust doesn't count as fiber. Stay hydrated. If you are an adult, take minimum 2 to 3 liter of water daily with an average of 2.5 liter, except if doctor advised you for some water restriction in kidney or heart diseases, etc., etc. Fiber without water is like soap without water. It just sits there. Drink enough water to keep things slick and smooth. Water, as fiber, is in nature's plumbing service. Move your body. Walking, stretching, dancing, anything. Exercise helps your intestines wiggle along too. Don't ignore the call. Bathroom urges have a short expiration date. If you wait, the stool gets drier and harder. Have you ever made a mental deal with your colon? Like, just 10 more minutes, I swear. We have all bargained. Home remedies. If you want to go the natural way. Prunes, the classic. High in fiber plus sorbitol. Psyllium husk. Added to water or smoothies. Aloe vera juice? Great. But moderation is key unless you want a different kind of emergency. Moreover, some people has developed allergic reaction from aloe vera. So use only with caution. Hey, a bonus tip from your doctor friend. Try this. Drink 1 glass of warm water in the morning just after waking up in empty stomach every day for 7 to 10 days. Not just water, warm water, and see the results. If you are in the starting phase, it will give you relief. Another bonus tip. Have some mung bean sprouts in dinner alternate day or 2 to 3 days in a week. Please do not take regularly. You may get soft stool. Everything should be in limit. Just a cool trivia. Prunes were rebranded as dried plums in the US. Why? Because prune sounded too old-fashioned. Marketing geniuses, honestly. But, and this is important, if you have severe pain, blood in stool, sudden weight loss, or things just aren't getting better, please see a doctor. Better to be safe than stuck. All right, let's smash some constipation myths. You must poop every day. Nope. What's normal for you might be 3 times a week. Chill. Most persons have at least 3 bowel movement per week. However, low stool frequency alone, not the sole criterion for diagnosis of constipation. Laxatives are evil. Not true. Occasional use is fine. Just don't depend on them without your doc's guidance. Melanosis coli, or pigmentation of the colon mucosal, indicates the use of anthraquinone laxatives such as Cascara or Senna. Only old people get constipated. No way. Kids, teens, young adults, constipation plays no favorites. If stool is not coming out, you should strain to the fullest. No, never. Excessive straining may lead to development of hemorrhoids or piles. And if there is weakness of pelvic floor or injury to the pudendal nerve, may result in obstructed defecation from descending perineum syndrome several years later. Hey, guess something. What's the only thing more universal than taxes? You guessed it. Bathroom troubles. Doctor's investigation and approach. The perception of hard stool or excessive straining is difficult to access objectively, and the need of enemas or digital disimpaction is a clinically useful way to corroborate the patient's perception of difficult defecation. In the vast majority of cases, aga 90%, there is no underlying cause, and constipation responds to ample hydration, exercise, and supplementation of dietary fiber. A small minority, probably less than 5% of patients, have severe or intractable constipation, and 25% have evacuation disorders. These are patients most likely to require evacuation by gastroenterologist or referral centers. A good diet and medication history and attention to psychosocial issues are key. Doctors usually have physical examinations, as well as mandatory rectal examinations. The presence of weight loss, rectal bleeding or anemia, which constipation mandate, flexible sigmoidoscopy, plus or barium enema, particularly in patients more than 40 years, to exclude structural diseases such as cancer or strictures. Colonoscopy alone is the most cost-effective most of the time because it provides an opportunity for taking biopsy of mucosal lesions, removal of any polyp or dilate structures. Barium enema has advantages over colonoscopy because of being less costly and identifies colony dilation, measurement of serum calcium, potassium, thyroid-stimulating hormone level will identify rare patients with metabolic disorders. Patients with more troublesome constipation may not respond to fiber alone and may be helped by a bowel training regimen, which involves taking osmotic laxatives like magnesium salts, lactulose, sorbitol, polyethylene glycol. There may sometimes be use of enema or suppositories of glycerine or bisacodyl to evacuate. After breakfast, a distraction-free 15 to 20 minutes on the toilet without training is encouraged. Those few who do not benefit from the simple measures as discussed above all require long-term treatment or fail to respond to potent laxatives should undergo further investigations. Secretion-inducing agents such as lubiprostone, chloride channel activator, linaclotide, a guanylate cyclase C agonist that activates chloride secretions are prescribed by doctors. Please do not self-medicate as these have its own adverse effects, so dosage and duration should be adequate. Quick recap, rapid fire, recap before we wrap. Less than 3 poops a week, plus hard stool, ale, constipation. Causes? Low fiber, low water, lazy lifestyle, certain meds, health conditions. Fix it with fiber, hydration, movement, quick bathroom breaks. Seek help if serious symptoms pop up. Quick audience challenge. Drop a poop emoji in the comments if you're feeling relieved just knowing all these. At the end of the day, constipation is totally normal, super common, and 100% treatable. Taking care of your gut health is like maintaining your car. Don't wait till the check engine light comes on, right? And remember, happy gut, happy life. If this video helped you, smash that like button, subscribe to DocDecoded, and share it with someone who's been a little backed up. You'll be doing them and their intestines a huge favor.